Hey guys, I am going to walk you through how I do a little glow up for my patient. This includes 1 syringe of Radiesse and 2 syringes of filler. So, right now, I just did a little bit of numbing for her, and this is what's called my introducer to my cannula. Notice she is a little bit bleedy. She's very fit, very active. She takes a lot of supplements, so that can be completely normal. Right now, I'm showing you how to check your depth with your cannula. You can see me tinting it up to make sure that I can see the outline of the cannula, but not the gray of the cannula. The perfect depth for a 1-to-1 dilution in this area is going to be subdermal. So you will hit a little bit of resistance, which you can see that I'm hitting, and you're going to inject nice and slow linear threads. If you are gliding right through, then you are probably too deep. And you really want to make sure you're either on periosteum, so on bone, or you are in that subdermal plane. An amazing trainer, Kelly White from MERS, likes to use the analogy of your cannula being a sheet. If your cannula is a sheet, then you are likely in the perfect depth. If your cannula is a comforter, then you are too deep. Notice though, my patient is comfortable. I am doing everything I can to keep her comfortable. I'm using both hands to make sure I'm in the correct plane, and I'm watching for color changes and comfort level the whole time. Okay, now moving on, I'm showing you how I'm addressing the deep medial cheek. I'm taking my needle, making sure I tap the bone, and I'm going to aspirate. Now, you really need to be mindful of anatomy. We need to think about the transverse facial artery, the zygomatic artery, and the infraorbital artery within this area. Again, aspirating does not mean you are 100% safe and not in an artery, but it is one thing you can do to reduce the chance. Notice I'm pushing nice and slow, and I'm again watching for color changes, assessing my patient. You can see the X underneath her eye. That's where I could actually palpate the infraorbital artery and know to avoid that area. Okay, so showing you again on the other side, I'm picking up the tissue, making sure I tap the bone, using one hand to stabilize while I aspirate with my syringe. After aspirating and not having a positive aspiration, I'm going to use one hand to stabilize the needle and the other to push, and I'm going to inject really slowly. And I typically will not do more than zero point 0.2 at a time with a bolus. Moving on to the lower face, I'm showing you guys a little assessment how I can squeeze the tissue and it collapses on itself. So she's a good candidate for a little bit of volume replacement in this area. Again, I'm doing a little lidocaine with epi. It does burn, but it will help numb the area. This is where I'm creating, again, the entry points for my cannula. So now I'm showing you guys how I'm injecting the chin shadow. I want to make sure that I am superficial and in layer 2. Now you can see her, she's a little uncomfortable. I tell patients this can be a little spicy. This is where we're subsizing the area to help our product lay down a lot softer. Now, again, this area, just like everywhere on the face, you need to be really mindful of anatomy. I'm thinking about the labiomental artery, the inferior labial artery, as well as any of the mental arteries. There are so many arteries on the face, and while we cannot know exactly where they are without an ultrasound, we have to be super mindful of them. And you can notice I'm always moving my cannula. I'm injecting in layer 2, which is the right plane for this particular area, and that's how I'm going to be the most safe. Okay, now I'm doing a safety test. This is where I'm checking the patient's capillary refill. I'm using my finger, I'm pressing down with pressure so that I basically pause any blood flow to that area, and that's why it turns white. And then the tissue should come back to its normal color within 2 seconds. Okay, now I'm finishing up by giving her a little support at her oral commissures. You do have to be very careful in this area because the facial artery is typically about a thumb breadth away from the corner of the mouth. So make sure you're aspirating or constantly moving your needle for safety. Okay, guys, and these are her results immediately after. Her before was taken in a previous session where we did a full face of tox and we did a little bit of lip filler. But after today, she's essentially had 1 syringe of Radiesse and then 2.5 syringes of filler and a full face of tox. She looks refreshed. She looks a little bit brighter, rejuvenated, but she does not look done. And that is always my goal as an injector, to keep my patients very natural. Now, I would recommend probably another session of biostimulation and maybe a little bit more filler to really get her where she wants to be. But overall, we were very happy and pleased with her results. Questions, drop them below.